The average time of a doctor's visit is less than 20 minutes, and too often patients leave with more questions than answers. So how do you ensure that your concerns are heard and that your physician is really listening? Ray, can we bridge the communication gap between patient and doctor within such a short time frame?
Very hard, but you just have to get your point across, and you have to come with intentional questions and know how you're addressing the physician, and also think about how the physicians we are taught and how we think. So most physicians are taught, look at symptoms, diagnosis, so they're listening to what you're telling them, what you're feeling in terms of objective things like, I've had a cough, how long have you had it, when did it start, all those different things that you can help us to make that diagnosis, because really you're trying to go very quickly on a very limited time.
What would you like the patients to do? How would you like patients to prepare?
Well, I want patients to come in and tell me specifically what they're feeling and why it's a change. Something has changed and how it's affecting them, and that this is not their norm.
You have to realize, especially with our aged community, we're dealing with hearing loss, we're dealing with processing that's slower. Not that there's a cognitive impairment, but we process things slower as we age. And so the time that they come in and they start to talk, and then you're not, the doctor's talking and you're not even processing what's being said. And most of our aged community, they have a white coat syndrome. Like, they've already held our doctors up to this higher level, and they don't feel like they're talking with a peer. They feel like they're being in the room with somebody that's above them. So asking questions and insisting on good care is not in the norm.
That's why I like to tell people, bring somebody with you just in case that happens, and do a detailed write-up of all the medical history that you think might be important and the issues that you want solved. Hand it to the nurse coming in when they're weighing you and taking your blood pressure. Make sure the doctor gets it before he walks in, so he or she can read through it, and then when they're listening to you, they've already heard some of it so they can process faster.
And to the point, yes, bring somebody in if you can, but if you can't, like, I lived in California. My mom was in Kentucky. And I was able to attend almost every doctor's appointment she ever had on a phone. She would call, put it on speakerphone, and the doctor knew and would talk to her and talk to me. I could ask questions. I would hear what was being said, and I could help her process it. So if you're that loved one and you can't attend in person, can you take 7-8 minutes and be on a phone call?
I love putting them on speakerphone. I think you're going to get more intentional care, more time. And remember too that if your parents are experiencing brain change, they might just say, oh, I'm fine. And you might feel very frustrated about that, but that's maybe just where their brain is at. So really do need people to go with you and get paperwork signed early on so you have the authority to speak to the doctor's office. Stay with us. You're watching Aging Untold.